The South African Medical Association remains concerned by the changes which will be brought about by the introduction of the National Health Insurance Bill, should it be approved at least. The legislation will see everyone, regardless of their financial position, covered by insurance. Now, Russell Rensburg from the Rural Health Advocacy Project joins us now for a conversation. Russell, thank you so much for joining us on the Weekend Report this morning. Hardly anyone, in a lot of the conversations and debates that I've had an opportunity to watch or to listen to, hardly anyone is against universal health care. But I think in a country like South Africa, with the socioeconomic context that we have, there probably would be some unintended consequences in a rollout of something like NHI. Talk to us about some of those concerns.
Well, universal health coverage is not an option. You know, it's an absolute necessity, particularly in a country like ours where everybody is guaranteed the right to access healthcare. But delivering healthcare is complex, you know, and it affects many different things. And I think what, in our view as the Rural Health Advocacy Project, we've seen these reforms presented by the National Health Insurance as an opportunity to maybe address some of the lessons and challenges that we've experienced in the delivery of healthcare over the last 30 years or so. Because on average, South Africa, the 80% of the population is not in good health. You know, if you look at the most basic health essential services, like access to maternal and child health, like access to treatments for curable and treatable diseases like tuberculosis. If you look at the growing leading cause of death being non-communicable diseases, you know, we're way below the global targets. But when you look on the opposite side of that, we do have healthcare capacity. But a lot of that capacity is being utilized by the people who have the ability to pay. You know, we spend more money on medical insurance and obviously the services that are bought with that medical insurance for 15% of the population than what we do for the entire population. So I think the status quo can't stay. And we can't talk about universal health coverage if we continue to tell the people that need the care the most that they must well wait until things improve. So I think that's the starting point for the conversation. If we all agree on what universal health coverage is, then we should sit down and figure out how do we chart that path. And I think the NHI health reforms on their own won't solve the problem. But what is needed is we need to sit and negotiate and see how do we restructure this health system using this new reform to ensure that the people that need care the most, particularly those in rural areas, are able to get the services that they need.
Yeah. You talked about lessons that we've learned in the last decade or so. I would like to draw from lessons learned more recently during COVID-19. We learned then that South Africa doesn't have enough healthcare workers, that the healthcare system is unfairly distributed, as is the case with a lot of other issues in this country. What would an NHI rollout mean for people living in the rural areas? What are the sort of unintended consequences that they would experience in such a rollout?
Look, I think like I said, I think we take a positive position on this. Currently, the way health is structured, health is, you know, the National Department of Health is responsible for health policy. Provinces are the main service delivery agents, and we leave it to them to decide what the quality of services are in the various areas. Because of how our health system is structured, you know, a lot of the money spent in the publicly funded healthcare system is on higher levels of care, and often rather inefficiently. What that means is that with this limited budget envelope that they have, the services at district level where rural communities access services often don't receive the funding that they need in order to meet the population health needs. Under the NHI, we hope, you know, by decentralizing funding to the district level and allowing district officials and politicians and communities to determine what kind of health systems they need relative to their needs, you know, we have an opportunity to address some of this ill balance and maladministration. There's almost no private healthcare in rural areas. So rural communities are almost completely reliant on the state for funding. But I think the things that we really need to work on is the governance and what informs the governance. And for us, governance is not really just about mitigating corruption, which is an important component of governance, but also how are we making decisions? How are we deciding where to spend the money? What is informing that? And I think South Africa has a well-developed system of health management information. And I think that the big task for us now is how do we use the information that the system is producing to allow us to spend the money better. And by centrally controlling the money in an NHI fund, particularly for publicly funded money, in the short term, allows us an opportunity to get more value for money. Right? At the moment, we're sort of just like trying to keep the lights on. And that doesn't necessarily mean that the money is being spent efficiently or where it's needed most. But we're not going to get there just by the stroke of a pen. It's going to require deeper engagement between all the different stakeholders in the health sector to ensure that we get the kind of health system that responds to the needs of the majority of the population. I think medical scheme reforms and the private sector health reforms, they deal with health care. You know, the private sector is very, very good at delivering health care. You know, but health is much more than care. And there's a whole lot of different things that need to happen, including things like health promotion, prevention, and also community outreach, which is something that only happens in the public sector and is not being done very well. So I think we need to focus on the things that we need to do. We need to use the information that's available. We have to develop governance mechanisms within these district management offices, within our hospital boards, and even at the local level that are more responsive to the needs of the community and ensure that there's greater accountability. But the status quo doesn't really present opportunities for equity, and in fact it perpetuates inequity by putting resources where people are willing to pay, whereas people that are reliant on publicly funded services have to just wait and see how far the money will go. And I think that's not sustainable in a country like ours.
I think you've raised such an important point, Russell, just in terms of how the conversation around NHI has been framed. There's been this sort of reframing where we're taking the right to healthcare, which is enshrined in our Constitution, and we're making it, as you've mentioned, an insurance cover issue, as opposed to being a greater sort of healthcare issue at a more foundational and fundamental level. How do we reverse that and change the framing of the conversation so that it is a lot more inclusive? The thing with NHI is that we still have a long ways to go before it's fully implemented, and now is the time to have the conversations that will potentially reframe and restructure what it looks like right now in its current state.
I'm of the view we have to change the name. It's not an insurance scheme. Right? It's in the classical sense of the way. You know, because it's a universal scheme that's open to everyone. We're not going to exclude, they're not going to exclude everyone. They're not going to have special prices for higher risk groups. You know, so it doesn't really have all the characteristics of what one would call an insurance scheme. Right? So the first step for me is really just all of us to try and understand, what does this legislation mean? How does it change publicly funded healthcare? How does it present opportunities for greater collaboration between the public and the private sector so that we ultimately arrive at a unified health system? You mentioned in COVID. You know, during COVID, more than close to half of all hospital admissions were in private hospitals, which is about 350, servicing 15% of the population. The public sector, on the other end, we had a big challenge with getting people to hospitals. One of the biggest challenges was a COVID test. More than 60% of the tests were conducted in the private sector, often because of the timelines and the costs. You know, I think it was a great cost to people. And I think we should look at all of these things and try and figure out to the extent to which our entire health system, both public and private, is servicing the needs of the population as a whole. You know, I think the health market inquiry also showed us that private sector healthcare is in desperate need of reform. You know, one of the things that we saw coming out of that report was that, you know, the way the costing models that hospitals are run on are not fit for purpose. You know, and at the end of the day, they end up costing the consumer more. You know, so I think over the next 14 years, which is the timeline that's been given for introducing these reforms, there's a lot of different things that need to happen at the same time. But I think where we are right now, we should have a singular focus on strengthening healthcare for all. And I think both the private and the public sector need to sit around a table and start a conversation for seeing how we mediate this transition to a more unified system. The current approach of saying we all agree with universal health coverage, but is not acceptable. You know, because I think in a negotiation process or in any reform process, there is a need for meeting of the minds and finding compromises.
Right.
And I think that's kind of where we are right now. It's really for us to put our fish on the table, to try and understand what we have, but especially given the fiscal constraints that we're facing, and what are the things that we have to prioritize right now. And for us as the Rural Health Advocacy Project, that means looking after people with the least access. So let's strengthen the rural district systems. Let's implement these reforms and try and learn lessons and seeing how and what additional reforms are needed for us to ultimately realize that aspiration of universal health coverage and health for all.
Yeah, when we talk about strengthening those rural district forums that you've mentioned, it's not just an infrastructure issue. It is also just the lack of healthcare workers that are operating or working in those areas. How do we create an environment that would attract health workers to come and work in rural areas and want to form part of those communities and form part of those efforts at strengthening what's already there?
Look, I think it has to start with the health management information for us and just to understand the things that we are not doing, that we should do. The second thing is that part of what draws healthcare workers to rural areas is either employment or contracting. Currently we don't have any posts available in the National Health Service, and it makes it difficult to attract and retain rural healthcare workers. One of the things that they introduce in the reform is the introduction of what they call an integrated practice. Right? And what it would do is you would create these resource envelopes in the rural areas that would make it attractive for private practitioners to come and practice in those areas, because there's actually a funding pool where they can draw on. At the moment, there's less than 10% coverage of medical schemes in the rural areas. Sure. So the result is doctors that are not in the employ of the public sector have no incentive to go there. But I think when we create pools of money in different districts, there are people that come from those districts that trained as medical workers but can't find work. And now with creating these funding pools, we create an incentive to draw people there. Rural areas are underdeveloped, so we're never going to be able to create all the enabling conditions, right? By having good schools, by having great roads and so forth and etc. And that should not be a condition through which healthcare workers need to practice in those areas. But I think in the short term, there are things that we can do. The first thing is creating financial incentives by creating these integrated practice. The second thing is to create networks where they can continue their personal and professional development. Luckily, with COVID, we saw an acceleration of the adoption of hybrid technologies. I think there's other things like e-health or telemedicine that can allow us access to specialists. But I think the most important opportunity that COVID presents, that we learned from COVID, is that we need a mechanism to contract in the private sector. That was something we were unable to do during the height of COVID, when we need, because of the legislative framework making it so difficult. And I think here's the opportunity for us to be able to draw from all the expertise in the system towards achieving the public aim within our limited resources. But we need to get better at managing our information. We need to get better at the efficiency in how we deliver care. And ultimately, we need to prioritize those people with the least access. Because we will not get universal health coverage unless we address issues around access to reproductive and maternal child health, improve coverage of infectious diseases, and begin to reorientate the system to start dealing with the leading cause of death, when you look at it collectively, of non-communicable diseases. But there are no answers, and nobody has a crystal ball. And I think all we need to do right now is try and understand the information, work together to see how we can work together, and create dialogue. And I think that's the only way that the reforms will be successful over the longer term, because everybody's needs are different.
Right. Well, Russell, thank you so much for coming onto our program and sharing your insights with us. They're greatly appreciated. That is, of course, Russell Rensburg. He's from the Rural Health Advocacy Project.